I'm Kelly Siegel, and this is Harder Than Life, a podcast about self-love, self-awareness, business, and health. We tell outrageous stories and boil everything down to simple, practical advice you can start using today. Let's get living. Today on the Harder Than Life podcast, I'm thrilled to welcome Dr. James Lewerenz. Not only is he the mastermind behind Longevity Health Institute, where he's been helping folks live their best lives for over 27 years, but also a fellow podcast host on the Deep Six podcast. Dr. Lewerenz is also about merging the latest in functional medicine with good old traditional care to keep us all thriving. With a resume that could probably put us all to sleep, he's here to keep us awake and kicking because we've got a lot of years ahead of us. Let's deep dive with Dr. Lewerenz. But guys, as you know, that I'm very passionate, being very into physical fitness. We're going to deep dive into what he does to keep me healthy and keep me here in these airwaves for a long time. So thanks for making the trek here today. We're in person, so it's exciting. Fellow Detroiter.
Go Tigers.
He was texting me last night with the Tigers game. That was awesome, dude. Big win. Everybody loves the underdog story. But
how can you not?
What I love about you is that you are, it's not even preventative. It's like proactive. Like the best defense is a strong offense. And that's to me what taking all these tests and doing all this work to keep yourself. Look at the shape here. You guys, if you aren't watching this on YouTube, head on over.
Well, I'm not like you, Kelly, but hey, I give it a good go.
So let's start off with what inspired you to specialize in longevity and functional medicine, and how did your training in emergency and regenerative medicine shape your approach to this?
Well, thank you for having me here, by the way. This is going to be fun, and we'll have a good time and learn a little bit, do some good stuff. Honestly, it was all organic. I, did an ER residency. I'm going to give you the cliff notes. Did an ER residency, did a family practice residency. I'm doing typical medicine. I was athletic at the time, nothing special, but, just competing in a little bit of hockey, mountain biking, things like this. But I was also, a dad, a new doctor, a new, everything. And, I'm just doing the grind, and my patients that I'm seeing are not really resonating with me. Now, I don't mean the ER because that's like life and death, and but I would go to the office and take care of people, and it was just not fulfilling to me. And then I did have a little bit of a medical issue, nothing significant, huge, but just enough to be like, well, this isn't normal. I was like 36 at the time, so I'm like, this is not normal, and I'm not accepting it. And I went to several docs, colleagues of mine, totally respect and everything. And the great guys, still friends with them, et cetera. But it was like, wait, something's being missed. You know what I mean? And I'm being blown off. And I would say, well, take off. One guy said, take off your cape. He said, one of his internists said, take off your cape, man. He goes, you're just doing too much. You got kids, you're mountain bike racing, you're doing all this stuff. And I go, well, that's true, but something's just not right. And, the traditional stuff that I was doing, even personally, in my office with my patients, it was like, I wasn't finding anything that was helping. And long story short is, after that journey and further education and, kind of deep diving into functional medicine, regenerative medicine, all that, I was like, okay, this helped me. Now I'm passionate about it. I'm fired up about it, and I'm doing good stuff, and I'm seeing my patients, and, I'm like, I can't just keep doing this. This wasn't fulfilling, I wasn't passionate about it, So I literally, I'm going to tell you this, my ex-wife, this is amazing. We are still good friends. I love her. She's a good person, and God bless her. She's fighting a little bit of a disease right now. And long story short, though, is I literally, no joke. To this day, she's like, you went to that conference we were together in Vegas, this regenerative functional medicine conference, this first one. She goes, you walked up to the Venetian, you went into the room. She goes, and you were so fired up. She goes, I thought you lost your mind. I thought you were nuts.
What do they say, that everybody's nuts until they do it?
And I go, well, hey, anyway, so I, that was the start of my journey. But anyway, when I just changed my practice, I literally took my family practice, and just slowly started integrating nutrition, diet, vitamins, looking at hormones, deep diving into things that, I'd never done. And the sad part is this, and I don't like to like discount traditional medicine and even medical school and all that at all, okay? Because it's got its place and it's got its foundation. But even right now, I just read in the New England Journal of Medicine, they are trying to propose a complete nutrition foundation that they would teach in medical school, meaning make it like standardization, because there's no standardization for this. So in medical school, when you go to medical school, you learn some physiology and you learn all this stuff, and you cut bodies apart and blah, 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 blah. And then it's like disease drug surgery. You know what I mean? So you learn this stuff, and like what was just blew my mind away at that conference I mentioned is I'm sitting there for 2 hours. It was 2 hours, first 2 hours of the morning, like 7 to 9 a.m. And I'm like, how the hell do I not know this stuff or practice this stuff? Okay. And it was basic. I mean, I learned it in medical school, but you just, it's 2 pages or 1 hour lecture and move on. You know what I mean? Mm-hmm. And so it was just a complete mind shift and, lit me on fire, passionate and everything. And I practice. This is what's crazy. I only have to this day, because when people don't like change. I had a good practice too. He had a pretty good practice. People loved me. It was all good. I was blessed because I took over my dad's practice, and people don't like change. A lot of people, yeah. And to this day, I only have probably 5% of my original patients 15 years ago 16 years ago or so when I switched.
So you were a savant. You did that 16 years ago. Now it's like with Obamacare and the way medicine has become, it's like you almost have to have, and I know you call it the concierge service that you offer to your people where they pay a premium. Well, It's not even really a premium. It's actually, if you equate it to your health, it's worth it.
Yeah.
Like you pay that little bit of money per month, you get the premium treatment from you, and you feel better, and you can do better, and you can do bigger. So this is you guys all want to know my cheat code at 48, soon to be 49. This is it. We're going to get into it deep, and it's really affordable, guys, but this is how I get on the offense, and look at this guy. We look super young, and it's from taking care of ourselves. And I love it. The story that you just said is exactly how I started my IT business, by the way.
Yeah.
You just you're in the right place in the right time, and it's not luck. You prepared for years to be ready for that. And for those of you guys listening and you're not sure what you're doing, you're like, I don't know, I just want to be like Kelly, I want to be like Jim. You got to prepare space and allow things to happen. And boom, this guy's the preeminent. He's still under patient doctor privilege, so you can't say who his patients are. But I've seen some of them in the waiting room, and they're big people that you guys would know. So if you really want to get on the offensive, work on your mind, and then come to Dr. Lewerenz's Longevity Health Institute and work on your body. So let's talk about this traditional versus, I was going to ask you, one of my questions was, what do you call traditional medicine? So you call it traditional. So you focus on both traditional and the functional medicine. How do you integrate these two practices to benefit the patients?
Well, to me, it's real simple. It's not rocket science and all that. Again, all this just happened. You're right, prepared, but I was always life prepared. You know what I mean? I was very fortunate. I was blessed to be, born and integrated into a family that was athletic and, physicians and, entrepreneurs and all that.
No stress.
And we all have, right, tons. I mean, we all have our challenge. Believe me, there's no perfect at all. I could tell you, crazy stories, man. But my point is that I was, I had a lot of good foundation there. And, I call it the bounce back, I love the bounce back. I think my dad taught me that. And what I mean by that is, literally, hey, when you have an up and down and you have a struggle, hey, you learn, you get strengthened, it creates character, it's empowering, to get up. Sometimes getting up's better than, the being at the top. You know what I mean? But anyway, you asked me a question. I got off track, but I just want to lay that down there because it's interesting that you said that. But no, it's just that the difference, traditional medicine, kind of what I do, is it was really organic. I created a through physiology of what I had learned, a 6-point model. And I'm really dumbing it down to make it sound simple.
We have a question later on about this. We're going to deep dive into that 6-point model.
Yeah. But it's really just looking at the difference in traditional medicine And I use traditional medicine. I order MRIs. I order cholesterol. I order, I treat blood pressure. I have cancer patients come to me. I have, you name it, because everybody wants to thrive. Everybody wants to survive and kind of be living well and has goals, whatever those are, business, family, life, journey, whatever. Long story short, though, is that, we focus on goals in a we'll call it just this, a functional, physiologic, somewhat Eastern people. I had this guy yesterday say, "Are you holistic?" And I'm like, "I'm whatever you want to call me." Because, there's holistic principles and things we do, but some traditional holistic is they won't look at hormones. They won't look at genetics. They're like, it's just about the diet and all that. And that's huge. It's huge, huge, huge. But it's missing a lot of other things that in 2024 we can deep dive into, So anyway, that's the difference is, kind of being progressive, being preventative, being proactive, where, we want to think years, decades out to be in a kind of a longevity functional approach. We want to fix goals. We don't want to just treat and street. And in a traditional approach, unfortunately, this is the statistics. Your traditional doctor's got about 7 minutes nationally statistically average in the room with you. Okay. What can you possibly, I want to say a strong word here, I won't, but what can you possibly solve in 7 minutes in real health care in a visit? And sometimes people, by the way, see the doctor twice a year. So 14 minutes a year, they're going to keep you healthy and well. Really?
Yeah, impossible. And it just becomes a cookie cutter. It's, we see this, we treat it with a drug.
Right.
So I love that you just said treat and street. That's hilarious. Yeah. So, excuse me, I've been to holistic doctors. I've been to you. I've been to everybody before you.
Yeah.
And I really appreciate the blend because I know I'm getting it right. Because if you go to a holistic doctor, you're going to get holistic medicine. You go to a traditional doctor, you're going to get a traditional doctor. You go to a surgeon, they're gonna prescribe surgery.
Right.
So I always laugh when people go for back consultations and they go to a back surgeon.
Yeah.
Like, what do you think he's going to do? Hey, you come to me for business advice. I'm going to probably look at your IT. So
I mean, that's a good guess,
And then I look at, I love that you also said that you go in and you have goals.
Yeah.
And some of those goals probably aren't, hey, I'm sick. And it's like when I came to you, it was, bro, I'm tired.
Yeah.
And it literally was just, it turns out it was just not eating enough, which is crazy for me. Like, I just am so active that I just was, I just wasn't eating.
Oh, yeah.
And it was like, hey, eat more and take these vitamins and keep doing what you're doing. And it was treat and street. Get the hell out of here. Yeah. So it's not like you're going to come to us and he's going to get your claws in you and you got to come back and go to 45 different things. But I think you're going to like it and go into it deeper. But
the other thing I always like to say, and it's what you went through, is always remember what got you here won't get you there.
Oh, because we're changing. We're getting older.
Right. And so some people go, well, wait, I've been working out, and my doc, by the way, my doc ran my hormones. Well, he probably looked at your thyroid or something. I'm not saying he didn't look a deep dive.
Oh, and it never changes.
Right. Exactly. Or, I used to, I just need to clean up my diet. And maybe that was good for you and you lost a few pounds, but just always remember, like, what got you here won't always get you there. We change, we grow, we evolve. And that's really important to understand in medicine and definitely in prevention and longevity and thriving.
I think that's funny because it's just like how it is in IT. They're like, I didn't do anything. Like, you didn't search the web. You didn't do it. Like, oh, that didn't work for me. Well, how long did you try it? Oh, a week.
Yeah.
Like, okay. Boy, your business and mine are so very similar, and I love it.
Well, no, because I run your health and I run your body like a business. That's why it's very simple.
We just kind of jumped right into it.
Yeah.
Because I know, and I've been a licensed doctor. Someone could go. You could treat anybody. Could you do any telehealth? Or can you do anywhere? They have to come here.
No, and I have patients all over the country. Here's the thing: is we like to do a one-time deep dive per year. And that deep dive is really an executive longevity, like kind of physical. And we personalize it. But, I have somebody coming in next week from LA. Last week I had somebody from Florida. But, majority of our patients are, southeastern Michigan. But we do have people coming in all the time. What I prefer is at least one in-person visit. but we have some that just it's just not possible. So we do Zoom, and we do telemedicine and all that stuff. The only reason that there's some things that are, they're proprietary in our office, technology, testing, etc. They got to be in our office to do that blood test or to do that, brain technology test or to do that vascular test or whatever. We kind of modify it if they can't come in. So
let's walk everybody through that. But and by the way, none of the show notes gave me any. How do people get a hold of you? Where do you want them to go if someone says, "Dude, I want to look jacked like this dude," and how do I do that?
Yeah. Longevity Health Institute. Our website's longevityhealthinstituteinc.com. We're in southeastern Michigan. We got a couple locations, Bingham Farms and Rochester Hills. We used to have 3, and my staff doesn't allow me to have 3. But we have large practices. So I have 7 other practitioners with me, providers, doctors and nurse practitioners and that. And we have different models. So it's like, we are a concierge practice. We are a membership type of practice. But we make it affordable. So we have levels and tiers, and then obviously you get different things, but, great team. And we actually work on you, from everybody in the practice works on you from that foundation, from that 6-point model, which we'll get into.
Yes, we will.
But you can just look on the internet, social media.
If they go to, what's your social media handles? I don't have them anywhere.
I'll send them to you and we'll post them, but it's obviously Longevity Health Institute on Facebook, on YouTube, the Deep Dive podcast, which is my podcast about kind of what we're talking about today,
Yeah, guys, this is no joke, man. This is how I live and die by this. I got a million different doctors that I go to for everything because I want to say, I'm going to live to 120, doc. I'm convinced of it.
Yeah.
I sleep well. I really believe everything can be sleep, eat, and just resting.
Yeah.
And a good exercise.
Yeah, I was going to say move. Yeah, you got it. Yeah. Of course.
So,
no, for sure.
Let's walk through that again. They go to the website and they only have to come once a year. And I will tell you why you'd want to come here. And if you're coming to Michigan, come in the summer, July preferably. Yeah. It's actually really nice here in July. Oh, yeah. Otherwise,
all my entertainers, all my people that come out, no, they will only come. It's so funny what you're saying. They will only come. They'll stay in Birmingham. It's so funny, and they're like, well, April, May till like October, but that's it. So they won't come
It is beautiful in Michigan in the summer. And that's why we live here, guys, because that's why I have a house in Florida. I get the hell out of here during the wintertime, but it's beautiful. So come see doctor. And the beauty part about it is you do have everything right there in it. So I needed to get some blood taken out of me because I had too much iron, and we did it right there in the office.
Yep.
So he takes care of everything. This is not a insurance and we're going to blast everything, and it's very affordable. So they go to your website. They're going to come in. They're going to do some blood tests. They're going to meet with you, by the way, too. I want to point that out. Yeah. They meet you, not an associate, not an assistant. You actually spend a good 30 minutes with people.
Well, yeah. I mean, if you're I have another doctor and other practitioners. But yes, if you're fit, meaning my tier, if you will, is with concierge medicine, you'll meet with me. And actually, I must sped you up. Because everybody gets an hour. I usually you can get whatever you want, but usually I can handle things within an hour. You were easy, so I gave you 30 minutes.
Yeah. I was specific. I came for one thing. It was like, I need to sleep better. And you're like, dude, and you nailed it right on. You're like, I guarantee you, I've seen you at work. You go so hard, you just fall on your face. And I'm like, were you freaking got a camera on me?
Yeah.
It's 30 years of doing this stuff.
Right, yeah. But exactly, but the big thing is we brought this up, but this is big. And even just for anybody out there, whether they come and see me or not, which, hey, we're taking new patients all the time. But I would stress this: set goals for yourself. And when you go into your appointment with your practitioner, whoever that is, whatever model that physician or practitioner is, set goals. Don't make them astronomical, meaning because you can reset goals in 3 months or 6 months.
What do you see as the number one goal? Sorry on that. Is it to feel better? Is it to look better?
Well, probably the top 2 are energy and weight. And people want to lose weight. People want to get energy. I'm making it simple, but
okay.
That's the big. Some people, it's a brain fog. Some people, it's bad guts. Digestive issues, food sensitivities. Some people, like I said, they used to work out. They used to be fit. They used to be energetic. And they're like, I'm not getting the results I used to. So when I say weight, I don't mean some people. It's like just gaining some muscle, losing 10 pounds, and they go, "Why? I don't know why I have these 10 pounds. I used to be able to get rid of them." But funny thing is, because I do see women also, so it's like hair loss, call it this, the mommy tummy, you know what I mean? Like they're skinny fat, you know what I mean by that?
Total. Oh,
yeah, so you get into perimenopause and, they're like, I don't know what's going on. I mean, they look good, but I'm sure if they take their clothes off, but they have like the mommy tummy and it's driving them nuts, but yeah, energy.
And you can help with that?
Of course.
It's not a surgery.
No,
you're going to get it done with the diet and exercise and I bet you a lot of what you're doing. A lot of what I'm hearing is mind. It's in the mind.
There's a lot of mind-body connection stuff we work on.
Just truthfully, that's literally the number one thing that got me to sleep and got me back to normal. Was I just had to make sure and just focus on my sleep. So my goal was to sleep more, or to have more energy, and it was literally to sleep. Yeah. I had to get more restful sleep and feed my body. And the funny thing, since the last time I saw you, and next time I come in, you're going to yell at me, but I've added 10 pounds of muscle because I've slept well. And I was like, oh, you took steroids. No. I take testosterone. I take testosterone cream. I'm 48. My testosterone is like 250. And I've increased that. And I'm getting better workouts and eating more. It just has such a trickle down effect. So let's go. This seems like a perfect time to talk about the key principles of your preventative health and how you apply them to achieve optimal health for all patients, but specifically the 6-point health foundation model. Let's talk about it.
Yeah. So the 6-point model, which is just a model, it doesn't mean this encompass literally everything, but I will tell you that I can improve, normalize, reverse 99% of things if we work on this model. There's the esoterics, the rare ones, because I do have people that come into my office with these really unusual things from other states and diseases, and I'm not making this up. I have to but that's the 1%. Okay?
We'll talk about that too, because AI is going to help you with that.
Oh, yeah. But that's the 1%.
Yes.
Those are rarities and all that. But the 6-point model is we always consider and deep dive into hormones, genetics, your gut health. And when I say gut health, I mean also nutrition and your nutrients you absorb, etc. Liver and detoxification and toxins, okay, because our liver is our filter. We are the filter. Mind-body connection, so, just like you mentioned, and then also structural issues. And I call it like a matrix. Those 6 things are like a matrix in how your, body works, the physiology, okay? Now, people come in and I can't, the executive deep dive longevity physical, we do this, but it's very hard to okay, I'm 50 years old. Let's make this. I'm 50 years old and they come in and, they have 10 issues, but we may solve 3 or 4 in the first few months. Okay. But with this interview and with things that they fill out, etc. And I'm really, really big on this in the practice. We are going to make, an actionable immediately. So to make them better immediately. In fact, I want people leaving the office, not with education, not with just understanding and visualization in that, so that they're compliant and they understand what's going on. But we tend to give them something when they're there that I know that they need, so that they actually, they're not fixed maybe in visit 1. But before we even have labs back and everything, I'll be like, whether it's B12, magnesium, whether it's potentially, this is, unique, potentially a hormone, but whatever it is, better sleep, something for sleep, all that stuff, so that they literally, we're right away like, oh my God, I see them in a week for their follow-up or do a Zoom on a follow-up and they're better. But when you look at, genetics, hormones, gut, nutrients, liver, detox, structure, and mind-body connection, you can solve. And I'm saying a big statement, everything.
No, it's you encompassed everything.
And they affect each other. Do you know what I mean? They affect each other. So, and why, people nowadays, I will say this because genetics are huge. We got great genetic testing now, full genome sequencing we can do for very affordable. It used to be like $5,000. Literally, it's like under $1,000. I mean, I think the last, I can't remember all the numbers, but it's like $600-$700 now.
It's not much. I did it. It's extremely accurate.
Yeah, but that's for like full genomic sequence, so we know all your DNA. But the point here is in the genetics is this. Genetics help us, because this is the thing is, I'm going to solve your goals and I'm going to make you thrive. You're not dropping dead on my dime or my time. And I say that, this sounds crazy, but listen to this. Anybody can make anybody energetic. And I shouldn't say, what I mean is,
I know what you mean.
Give somebody a hormone inappropriately. Give somebody some drug inappropriately. Give somebody, all of a sudden, yeah, that is better. That is better. If you don't know your genetics and your underlying things that are going on, you could be making yourself at risk. So we always look at the full picture so that we prevent. Because we're always thinking the long game. You know what I mean?
I'm laughing because before I went to you and I told you the doctor's name, there's a local doctor who's not practicing anymore, might not even be alive, and literally had a pill for everything. If you had a heart, you needed energy, here's a pill. Here's a thyroid pill. Yeah. You couldn't get your erectile dysfunction, here's a pill for that. You have anxiety, he was a pill dispensary. Mm-hmm. But that's what makes you this very unique, your Longevity Health Institute, because you have the gut, the hormones, the genetics, the liver, mind, body, and structural. You can't get that from a functional medicine doctor or a holistic only. You have to go to both, and you're getting that. Yeah. What do you find is one of them has to be a little bit more of a culprit than others at adding to our unhealthy America? What would you say it is? Is it gut or is it hormone?
Well, that's tricky. But you did hit the two top of the 6-point model that are probably the biggest issues. So you said, what is it? Well, there's always more than one answer. So I'll kind of load this answer. But of course, our biggest issue in America mostly is diet. Mm-hmm. Overeating, not in your case, you were the opposite, but overeating, overconsuming, inappropriate diet, which then causes gut issues, which then causes, nutrient depletion, lack of absorption, inflammation, autoimmune reactions, food sensitive. I could go on and on. So that's our biggest thing. I mean, if we cleaned up our diet for you out there, if you have an issue, clean up your diet, eat from the earth, or if it's walking on the earth, you know what I mean? Yeah. Non-processed and what, hey, your great grandmother was eating or cooking or making or whatever. Okay. That alone, but just our food industry and what we consume and all that. And a lot of it's media and put in our face and all that. I don't even blame the people as much as just the whole system. You know what I mean? But if you clean that up, that's huge. But, you mentioned hormones. That's a whole nother thing we can get into. It is huge because we're seeing an epidemic decline in hormones, aged match that we've never seen before. And not just in men. In women, infertility is higher than it's ever been. And there's reasons for this, which are endocrine disruptors, toxins in the world, toxins, what we eat, breathe, etc. So, but gut and hormones, I can't give you one answer. We
could do a whole podcast on just that. The toxic.
I can have a whole practice just on any of my 6-point model.
The toxins in the world of what we eat and what we take in and just the competition in the world today. Like me, I feel like I have to freaking go. So the moment I wake up, I just learned my mind was I had to be harder than life every day. That's the name of it. I gotta be hard. Yeah. No, I don't. Harder than life of me is just being and not always doing. It used to be do, go, because the competition's bringing down my back. Hey, guess what the competition doing isn't freaking relaxing.
What did I text you yesterday? What did I text you? We didn't talk before the show, right? What did I text you yesterday? I told you I was at the Tiger game.
You said life balanced. I said you're living life the right way, and you said it's balanced.
I texted, because it's any too much of anything isn't good.
I had a guy says everything in moderation, including moderation.
Yeah. So you just got to remember everything's all balance, and I meant that though because of course you got to enjoy. I was at the Detroit Tigers game. I was fortunate. One of my buddies and good patients, actually, he's a lead singer of a rock band, I Prevail. He invited me, and I'm like, I'm there, man. I 100% because I never go to Tiger games. I mean, I shouldn't say never, but I haven't been to one in a couple of years. Well, no, I went last year. But anyway, the point is that I was like, you gotta enjoy life. You gotta enjoy life, and you gotta slow down sometimes too, and not just be grinding. I'm a grinder, just like you.
Yeah.
But you have to sometimes pump the brakes.
Yeah, we gotta. It's in those sacred pauses. So I want to do a disservice for you, and I want to make sure people understand. You can't. He's not gonna. He just told you, don't come to him if you think it's going to be easy and cheap, because it's not a quick fix. He's not going to prescribe you Ozempic. He's not going to do. It's not that kind of practice. You have to come in and do the work, because that's what I like telling people in my business and in my coaching. It's, guys, we stress results, just like you said.
For sure.
He runs EOS, Entrepreneur Operating System, in his company as well. everything starts with core values, and I would bet, I can't even remember what your core values, but I remember they aligned with ours. 100%. I'll bet you one of them is results.
In so many words.
Yes.
Yeah, so, absolutely.
If you're coming...
But one thing you said, if I can touch upon, I don't mean to interrupt you, I just want to tell you this, because this is a mistake, whether people come and see me or not. Okay, this is one thing, and that I'm going to say a public service announcement. Okay, no, do yourself a favor in this. See somebody that's all encompassing, that doesn't run thousands of dollars in tests, that they have no idea what to do with them, and or after $2,000-3,000 in tests, they give you some, or so deep dive into who you're seeing. And the reason I say this is this: I'll have people come to us and they've been struggling, and it's real. I mean, this is real health stuff. Sometimes it's not just energy. It's like they got autoimmune disease, maybe they used to have cancer, they maybe have mind body stuff. They've lost, literally, I have somebody I saw yesterday that this is horrible. Her son at 16 died of sarcoma. And so it's obviously there's a lot of psychological mind body stuff going on with her. My point is this though: somebody will come into me frustrated because they've been to other places, spent thousands of dollars
and time, which is money.
Oh, and then guess what? They're not that complicated, because we set the goals, we look at the model, we look at what they need, and it's like, oh my gosh. And I'm telling you, I see this all the time. And what's sad is that there's so many, and I don't want to knock the whole functional holistic system, but I will say this a little bit, is this: that know who you're seeing, because there's a lot of practitioners, doctors out there that do tons and thousands of dollars of testing and don't really understand the physiology and the background of what to do with it, and so that you can be healthy and get better. So, a public service announcement.
What drove me nuts, and it's funny, my girlfriend just went through this.
And I need to say this: I don't need a new patient. I'm not trying to sell this. I'm very busy. You know that.
He pulled up, ladies and gentlemen, he pulled up in a brand new van, looking good. And look, this is not for that. This is to do good for people and get people healthy. I believe a united America, we're not going to go into politics, but a united America, a healthy America, a good mindful America. All too often I take in social media, the people that I'm getting abused by are people sitting on the couch getting fat.
Yeah.
So it's like, hey, I just do what I do. I don't take days off. It works for me.
Yeah.
It's going forward. So no, I'm not, but I do want to put you on the spot, and I'd like that answer. This is going to be a tough one. You're not going to want to answer this, but if you had to go to one or the other, a traditional primary care physician or a holistic doctor, who are you going to if you're relatively healthy, but you just want to go to the next level?
Yeah. So you got to define that though. What's a holistic doctor?
Well,
I mean, there's, because it's a here's why I'm saying, I'm tongue in cheek a bit, that's really gray, vague area right now.
But I just say anybody other than a family practice, a general practitioner, anybody other than a person who's going to go prescribe you a medicine.
Yeah. Well, I think this is, knowledge is power. And I think so. I want to be clear. Everybody should, because we're sicker, we're living longer, but we're living sicker. That's statistics.
Is that really living?
Yeah. Okay. So, but I want to say this is that, so everybody, by the way, if you have a loved one, if you have a child, if you have a family that people love and care about you and put time into you, put time in yourself. Everybody should at least see somebody, a practitioner, a doctor. I'm going to say the first thing you should, now you said I'm going to get to your question. I'm sorry, but you should at least get a, yearly checkup and see your traditional family practice doctor and all that.
When should they start that? Like if you're at 25, at 30, or
oh God, great question. I love this because we didn't prep this either. This is awesome. I love this.
So we're supposed to do.
No, because you asked me this. No, this is great. I tell people when I get I say about 30.
Okay.
30, 35. And here's why. You could feel great. 30, 35 is this. If you see somebody, that's good. And if you don't, walk out. But listen, get your hormones tested. All your hormones, thyroid, testosterone, DHA, cortisol, insulin, blood sugar. Okay. Those all, we could go into more hormones, but my point, those are key ones. Okay. And those are key at 30, 35. Why? That is typically when you're optimal. You know, I mean, obviously, you might be a little optimal at 25, 30, but you're typically 30, 35, you know, is not statistically where we see that much of a decline yet. It can happen, but not yet. My point is this. How do you know where you're going if you don't know where you've been? Okay. In the range of hormones specifically. So this is why I don't mean to, you know, kind of sidetrack your question, but the range of hormones is very, very drastic. A 200 deciliter, okay, to a 750 deciliter for a total testosterone. So that means you're 250, you're normal if you're a 35-year-old, 30-year-old. You'll get that test and the doctor will go, okay, I'm pretending I'm the doctor that you wanted this test. They did your testosterone. It's normal. Okay. The guy walks out. It's 250 and he's 35 years old or 30 years old. That is extremely low. Now, let's say he has no symptoms. He has nothing. Okay. Okay. God bless him. Okay. But at least he's got a data point when he has a symptom, because now he might not get, because there's a thing called hormone receptor activity, and he might not hit that decline in hormone receptor activity till maybe 180 or 200. And these are extremely low numbers, but I'm being extreme here.
Yeah, okay? I actually know that.
Okay. These are extremely low numbers. But my point is this, all of a sudden now he goes back to that guy or somebody else and goes, you know, I'm depressed. I really feel like down. I'm like dark. I'm like, I got seasonal affective disorder. I'm kind of sad, or by the way, my wife, because this happens too, they're only here because their wife, because they're grumpy and pissy and miserable. Okay. This happens. I'm telling you real stories. So guess what? He doesn't want to be here, but I go, well, you know, it's funny. 3 years ago, I drew your lab and it wasn't great. We talked about it. We talked about actionables, but you know, you didn't really have symptoms and you didn't want to do anything about it. So that's cool. And you didn't really have any symptoms, but now you're down like even lower and you're having a symptom. Okay. We're not going up with aging. We're going down, you know, hormonally. So the point here is that when you get a lab test and hormones and things like this and a checkup, a good checkup at 30, 35, you have a lot of baseline data points to compare to.
So I just wrote down, I wrote baseline data, because literally you have to establish a foundation of where you're at. And the beauty part about what you, and we haven't even talked about the technology that you use and how you weave it in.
No, let's do it.
Well, think about a traditional medicine doctor. He's gonna look at your EMR, your chart, your electronic chart, and just look at your last couple things in that 5 to 7 minutes.
Yeah.
And you have actually deep dived in that before you actually walk in, and you got all of the past and you've known it. Yeah. So you establish a baseline, you're looking at trends,
always trends.
And then you can also, now we're going to get into this eventually, is the AI model of saying, okay, a typical 48-year-old who is active like me, you're not going to treat me the same way you would treat another person that isn't as active, as big of a weightlifter. And you can adjust on the curve, actually. The bell curve,
for sure.
Is what it would be.
For sure. Well, that's where I got to the point, is how I said earlier, I run your body like a business. Okay. And that sounds weird to some people, but I want to explain, is you don't wait till you can't pay your employees. No one does that. They wouldn't be in business. No one waits till like, oh, we're out of that, we're out of stock, or nobody does that. Okay. You track metrics, whether it's you alone or you have a staff, supportive staff or whatever. You're tracking things so that you can stay in business and thrive. We do this exactly the same way with your body, which helps you, by the way, solve goals, feel great, be energetic and everything. I always say making a generational impact. And the reason is because it'll go in your home, it'll go to your spouse or your significant other. It just, it multiplies. But also we play the long game. Like I said, I don't want people dropping on my dime. So we literally will cardiac test, neurodegenerative test, you name it. So, but my point here is that we run your body like we track those metrics, because that's how you do true prevention, just like you have a great business.
So you're going to say, don't wait till it's too late, guys.
Yeah.
Because a lot of these, especially some of these cancers, can be that you can check precursors on some of this advanced AI testing now, where you could say, hey, you're a precursor to this. We need to watch out and we need to keep watching. And you can actually prevent the thing that's the biggest killer there is, especially too, you're reading more and more of
the
this.
number 2 cause of death is cancer. Okay. It could flip here post-COVID. And that's a whole nother podcast. I'm happy to explain it, all the physiology.
Wait, you went there.
The spike proteins and everything. But
can you share with me? Is the vaccine causing some of this stuff? Is there a correlation there?
I don't mind saying it, of course. And COVID. They're both. That's why it'll never be definitive, because the reality is they both mimic like each other. So how do you in a study do good data on that? You can't, because the vaccine and COVID, what's what?
And they're still pushing this on us. Well, you go to the freaking drugstore now, they're like, hey, you want your COVID and your flu shot? No, thank you. I'd like to live.
Yeah.
I mean, you're seeing these heart attacks happen at an alarming rate of young people.
Yeah. Sure, I'm going to do another public service announcement. Is that okay, Kelly?
Yeah. It's a big audience here, so we're here to help everybody. We've got to be part of the life.
Here you go. If you've had COVID recently, or if you've had the vaccine, and it's only about a 10-15% in my practice. So in my clinical practice, in the data, because we do some studies in our practice and follow, trends like we're talking, okay? It's only about 15%. It's close to that. I haven't looked at it lately, okay? But if you've been COVID vaccinated and or you've had COVID-19 infection in the last 6 months, you should always have a blood test that's called a D-dimer and a fibrinogen, because most of the complications from COVID, the vaccine and everything, and there's immune suppression and everything. But my point to this is you get hypercoagulable. Your fibrinogen gets higher, your blood gets thicker, your microclotting goes up. Okay. My point here is this. We don't, I'm talking very general. You got a guy that's got some early cardiovascular disease. You got somebody that's got some, peripheral vascular disease. He's 50, 60, 70, you name it or whatever. They don't know that's going on. It's there. They are now all of a sudden hypercoagulable from this. They're over their infection and or they got the vaccine, whatever, or both. My point, though, is that they're hypercoagulable. Of course shit's going to happen.
Wait a minute. For the listeners, guys, that means the blood is thickening up.
Your blood gets thick.
Yeah. So
your blood gets thick. In autopsies, this is documented. This is, you can look this up.
Wait, I'm hearing this right now. Yeah. So whatever this COVID is causing you to have the freaking heart, he's explaining it to you right now, people. So go back and listen to that, and then I'm sorry, keep going.
Yeah. Well, no, but just in autopsies, they're pulling out fibrinogen clots, which are like thread-like clots. Okay. And this was going on during COVID, and it's still happening. But you have to know your body. There's a book out. I love the saying, the body keeps the score. Mm-hmm. You don't get over, it's always there. You add something that's going to make you blood thick, hypercoagulable. It's a bad storm.
So the two tests one more time are?
D-dimer and fibrinogen.
D-dimer and fibrinogen.
No, I did say this, just to be clear. In my practice, in our studies and our data, it's only about 15% of people. It doesn't happen to everybody.
Right.
But 15% is a lot.
Yeah.
Okay. So you could go get your test and no, it was normal. That doc's crazy. Well, call me crazy or whatever, but if we save 15 people out of 100, sign me up.
Hey, if I'm one of those 15, I want it. So my next question was going to be, with over 27 years in the field, what are the most significant changes you've seen in the landscape of longevity and functional medicine? We kind of just talked a little bit about it. So let's go into the AI as well as anything else you'd like to add about, hell, there's Ozempic we haven't even talked about. There's
too much.
It's insane. Yeah. What happened to just good old American, let's just eat right, work out, and be nice to each other?
Yeah. Well, let's do it. I'm on board, man. Let's do it, baby.
I'll put you out of business.
Yeah, but no. Don't worry. Let me tell you, human nature can't put me out of business. I have all these Italian restaurant owners, my saying to them, and they come up and they see me and I'm getting them to lose weight and all that. And I'm telling them to be gluten-free. They're Italian. They own these Italian restaurants in our area, and I'm like, just so you know, I'm bad for business. Their business.
So what are you seeing with let's talk about with gluten free, what do you see?
No, but you asked me something I want to answer. I'm sorry. So just like technology and some of the new things, there's so many, but I definitely want to hit upon this just because it's true prevention. I'm big about true prevention. Okay. And that is, there's a test now in blood, Medicare in January of 2025. Okay. So that's for people that are over 65 that have Medicare. It will be fully covered. Right now it's been out for 2 years. The cost of the test has been about $800, but it's a cancer methylation cell screening test for 50 solid tumors. It's called the Gallery test by a company called Grail. okay, which is, on the public exchange, etc. Very, very good test. But here's the thing is we have to think of cancer, okay, as a chronic disease. Okay, if we think of and screen and treat cancer as a chronic disease, millions and millions of people will survive cancer. The data on stage 3 and 4 cancer is horrible as far as, 5-year survival, meaning you have to catch people at stage 0 and stage 1, and even 2s are kind of on the border. Point is this test checks in a cell type when you have a circulating methylation cell type that comes from the cancer that they can track and they can pick up. And some of the solid tumors are better than others. But the point is this one lab test that I think right now, don't quote me, you can look it up, you can call them, Grail Gallery. I think it's about $600 until, right now. I think it was about $1,000, okay? But it's about down to about $650, okay? Insurance doesn't cover it. January 2025, Medicare is getting on board and covering it. The point of this is that you can do that test once a year, depending on risk. Some people, they don't need it once a year, do it every 3 years or whatever. But you would catch somebody in stage 0 or stage 1 cancer, not only life-saving, but treatment-saving. You know how hell it is to go through chemotherapy and radiation? Even if you survive, it will destroy your, it's a no-win. And you're going to, what do you mean? I lived, I did chemo and radiation. It's a no-win. By the way, would I sign up for it if I was a stage 3 or 4? Probably. Again, that's a very general statement. But my point is this. The treatment kills and destroys our DNA. So your long game all of a sudden ain't a long game. I mean, you're destroyed from that treatment. So think of the difference, not just money, not just obviously life and comfort and family, and I can go on and on. Stage 0 and stage 1, those are curable, chronic disease type stuff. Easy.
That's pretty exciting.
Well, it's crazy. We've been doing this test in our office for 2 years, but the data has gotten better and better. Obviously, that's why they've gone public, that company. And Medicare to get on board with that.
That's huge.
It's huge. That means the government said, that's a whole nother topic, but
yeah.
they said, hey, this is worth it because we'll probably save some money. That's what. Hey.
Well, my next question was this, and we haven't.
That's right,
guys. You've made it 45 minutes.
Oh, I'm sorry.
Stick with it this far because we're gonna wrap up some of these health related questions. We're gonna have some fun with him. I know personally he's got a great life. I want to talk about it, but I want to ask you one that you just came up with is cancer is a big business. It's billions, probably in the trillions of dollars of business. Would they really want to put cancer out of business? Do they want to cure cancer?
We're not going to put it out. It's impossible. I mean, first of all, it's too dynamic of a disease to really, at least right now, as I speak right now, and there's so many factors that play a role that feed into cancer, but it ain't going away. But that's why I said. But what could help is our mindset change. Like we think of hypertension as a chronic disease. We think of heart disease early on. Well, he's got, got some heart stuff. Chronic disease, diabetes, chronic disece. Okay. Meaning treatable. People live into their 70s, 80s, 90s, they can. Okay. Let's think of cancer like screening like that. That's what I'm saying. So, it's a whole loaded question as far as money and government and saving and blah, blah, blah. Okay. And do they want it cured? Probably not. But I don't think there's any chance that unless something drastically changes in the future. You know what I mean? As far as, no, it's a moneymaker for sure.
I got 2 questions, 3 more questions that are health because this is just fabulous. I hope you guys are enjoying this as much as I am. Please rate this and share it. Go follow Dr. Lewerenz on social media. It's probably Longevity Health. We'll be in the show notes.
I'll be on next week. No, I'm joking.
But there was something specific I want to ask about. Oh, what are we going to do with all the people that you keep living into their hundreds? What are we going to do? That's a great problem to have, though, isn't it? That was a loaded question.
I've never been asked that. It's a problem. It is a real problem.
Think about the infrastructure in the world.
No, I know. It's a huge problem.
You're going to have more people on the roads. You're going to have more people on the internet. There's more just people to consume things. Sure. It actually creates that wheel of okay, how do we mass produce more food faster?
Yeah.
You can only have so many. The infrastructure can only handle so much. So it's a very interesting question.
No, it's a great question. I'm going to say this. I'm going to, and this is, but I doubt that'll ever happen, and I hope it happens. But here's the reason I say that is because of this.
Human nature.
Yeah. I hate to say that. Human nature. Between the food and the toxins and the, environmental pollutants and, just the way the world is and going. I mean, can people that are trying to thrive, trying to, live healthier and better and do good things, can they live and last longer? Absolutely. But when you talk about the populace at masses, I think, like I said, sadly, the bigger issue is this, and this is a podcast number 4, I think we're getting onto, but that will be this is what are we going to do? Because it's happening now and it's a big thing. Hey, you want to invest money? I'll tell you where you put money. You put money in these, extra care facilities.
Yeah.
These dementia facilities, these, nursing homes, etc. They're building them everywhere, by the way, but they can't keep up. We're living longer and sicker. So that's really the issue is, where do we end up in that place in the next, say, 20, 30 years?
Hey, guys, remember, people are like, I can't afford this. I mean, we've all seen the reel out there where it says, if I gave you $1 million, you'd be super happy. But if I say I gave you $1 million, you wouldn't wake up tomorrow. You wouldn't be, and you wouldn't take the $1 million.
Money doesn't create happiness.
I've said it 1,000 times.
Never does.
But happiness creates money.
Yeah.
So, guys, these tests that he's talking about, get them done. I've had them all done. I'm going to, one of your 6 principles is liver. We're getting my big story is that the going low and
were you at the Tiger games with me last night? You're talking about my liver?
How often are you seeing the fad that I'm seeing with a lot of people going low and no on alcohol?
Oh yeah. I mean, it's because it's absolutely, for sure. Statistically in the country, we're going up on alcohol. No, since COVID. I mean, it's out there. Yeah, that's. Oh yeah, since COVID, alcohol went through the roof.
Less people are drinking more.
Correct.
Especially here in Detroit.
No, this is legit. You're right. Yeah, maybe in Detroit in the winter.
Yeah. I think the summer does pretty well on the lake too.
Yeah, that's true. Yeah. So, but no, I do see that. Here's the thing is, but I mean, I'm skewed because I have people that are proactive. They want to come in. They want to get better. They want to, so a lot of my patients, you see, I'm just hypothetically, they're 80, 90% better. We've reset goals. Maybe they've been with me a year, 2, 3 years, whatever. Okay. A big one does become like even their commitment because they realize, look, man, I'm doing great. I'm so healthy. Sometimes one of the key X factors that is holding them back is alcohol, is too much or drinking at all or, what have you,
So what advice would you give someone starting their journey towards longevity and optimal health? Not everybody. See, you and I live it. There's people that listen to the podcast. We're top 20 now that are like,
congrats, by the way.
Thank you. When we get to number 1, we'll be very happy. We're trying. We just try to entertain and we model and inspire. And literally, it's really easy when you're in alignment. I live and breathe this stuff, so I love it. I love to tell and share. And we're gonna get, guys. You've made it this far. We're gonna get into some personal stuff with this freaking winner over here. It's all who we want to do. So, what should people? Someone's listening to this. Typical demographic with the Heart of Life is 25 to 55 years old, and he's like, God, Kelly keeps bringing on these doctors telling me not to drink, telling me to be healthy. What should they do first?
25 to 55, I think the biggest thing is this. I already said it, but I mean, because you can live right, you can exercise, move, eat right, sleep right, do all those things. Get some baseline labs. And you're going to say, really? Because, like I said, remember, I said we're in an epidemic of hormone decline. I mean, we see it. So they're doing the good stuff, or they aren't, whatever that is. But get the lab test, get the baseline stuff that you need at 35, 40. Some people, by the way, I'll get a 50-year-old in my office that's got, 5 drugs. By the way, multimillionaires, owns businesses and everything. So many money's not an issue. That was my point of saying that. No, but that was my point of saying it. Money's not an issue. And they're on 5 drugs. They've never had their hormones tested. They like their internist, which, by the way, I'm not knocking. The internist got a place, believe me. So I respect them. My point is, okay, they're running the hospitals and the sick people and all that. So that's why you got to say kudos to them. That's not a fun job.
No.
But my point here is they like them, a good relationship. They see them twice a year. They get their meds. Okay. 50 years old and they have the bank to support anything they would want to do. And they got all these medical issues and end up in my office and never had their hormones, never had a nutrient looked at. well, yeah, your cholesterol's good. I always say this, they got the blessing. But they moved on.
The healthcare environment doesn't lead to that either.
No.
Because
it's a sick model.
It's
a sick model.
If you order blood tests, if that intern orders the similar mock-up blood, the codes that you have to put in to get it covered, we'll deny it.
For sure.
So do they have to? Can they go to their internship and say, "I just want my blood panel drawn," or do they have to come to someone like you?
It depends. It's really dependent on the internist, the doctor. It really is. I mean, there's codes you can write and do based on some symptoms that cover stuff. But let's just say this, and I'm being devil's advocate, because the expense in labs is not that much. Because let me tell you, you pay cash for some labs nowadays.
$300.
I mean a deep dive.
Yeah, that's everything.
I'm not saying genetics and that, but I'm just saying the hormones and some nutrients and some pretty good stuff. Cash, $300.
Yeah.
You know what I mean?
And guys, you can do it. I'm going to steal his thunder for a second. I apologize. There is several people I've had on this podcast that do this tele. So I'm going to double down on what he just said. Get your labs done. There's so many ways to get it done. You don't have to go to him, but get it done because it establishes that baseline. Yep. It is affordable. And remember, $300 was the high end. There's $30 tests that you can do. They can send it to your house, and they can give you basic predispositions that you're at.
Just make sure you got somebody that you're confident. You're confident, not like wheel and deal. And not, by the way, I'll say this too. What you're paying does not mean there's value.
Yep.
I have people. I mean, you know what I'm saying?
Well, it's actually in IT you get what you pay for.
Yeah.
But in healthcare, it is not true.
There's some models out there where they're all cash based. They don't take any type of. We take some insurance. We use your insurance for what we can. That's.
I forgot about that.
Yeah. We do use your insurance for what we can. And because we order MRIs or we find disease or we uncover something that's not been, we use your insurance. It's just that we're a membership model in concierge because literally I'm at the Tiger game and some of my concierge patients that I personally see, they'll text me. They got some issue or some concern. They're able to text me directly. If they're bugging me about, their fingernail hurts, I might give them a little trouble, but we usually have good relationships. But my point though is that you can get some of these tests done. Just know that you have confidence and, you don't have to pay an arm and a leg, okay, just to get these tests done and have some direction. But don't just do your research. That's my point.
And then I've got so many of these blood tests done. Get the copy for yourself.
Yeah.
Because then you can share them with Jim, with anybody.
Yeah.
And just say, here, they read it and said this. And you can get second and third and fourth opinions. So what I especially admire about you is you're living life the right way. You're not a typical doctor with the glasses that's looking over the freaking clipboard and
but I can't see right now.
Good, because you're looking into a mirror. It's just as handsome. So what I admire is you're living life the right way in all facets. And I like to go to people that are winning in the areas that I want to win. And it's just all too often we go take advice from someone, like relationship advice from someone who's not even married.
Right.
So this is a gentleman who runs a business that's very successful on a system that we use. He's in good shape. If you're not watching us on YouTube, he's in fantastic shape. He's successful financially. He's successful internally. He's got a beautiful wife that I've met and is supportive. He's got a podcast. He's winning. Well, so let's have some fun and talk about this. Yeah. So this guy has a personality. He's not like, I asked him at first, and usually when doctors, you ask, what do you want me to call you? Doctor. You're like, call me Jim, man. Yeah. And so he has a personality. So you're gonna get entertained.
Oh, I have a personality. I tell my kids, my youngest now is 13 to 27. When all my kids
How old are you?
55.
Get out of town. You look great. Wow, I thought you were 45.
Well,
so you're making me look bad now.
No,
all right,
no.
55. 27 to 13.
Yeah, well.
So he's sexually active, guys.
Yeah.
When you see his wife, you'll see why. She's gorgeous.
Yeah. Well, I'm blessed. She's a sweetheart.
You did the work.
Yeah, I don't know how she deals with me, but that's a whole nother podcast. But my kids, this is funny because you said about the doctor thing, is my kids, I love this, man. And this is all of them. I did it to all of them. So the 13-year-old, he's kind of getting over it now, but, bring a kid over to the house, one of their friends, whatever. And I first meet them and they're like, oh, hey, hey, Mr. Lewerenz, how you doing? They're all scared when they're 10, 12, 13, 15, whatever. And I'm like, hey, nice meeting you. I'm like, call me doctor. Embarrasses the hell out of my kids. Like, Dad, I can't believe you said that. And they don't know how to take it, and then my wife smacks me. But, no, it's just funny, So, no, that's about the only people I make call me doctor.
Wait till the podcast blows up and you get to,
But I gotta say is I have 2 girls. So, and they're going to be, I look at them, dude, you're going to be rolling up on my daughter in a bit. So you're going to be scared of me.
How old are the daughters?
20 and 27.
And neither one are married yet?
No, one's close.
Okay.
Kind of close.
It's I have a daughter. She's 15. It's the best. It's the most humbling thing in the world. Because what I say, when you have a son, you worry about one penis, and when you got a daughter, you got to worry about them all.
Yeah, that's a very good point. Yeah,
and I got a beautiful one. So
and I do have a son. I got to shout out to him. He's in the USS Truman. He's in the Navy. So he right now is in the Red Sea. Got his last 9 months in the Navy. Real proud of him. So
a whole nother podcast where we talk about how they think about our beautiful military. Thank him for his service.
Thank you.
And I'm not surprised. You have a family full of winners. Winners beget winners. So look at you coming from your parents.
Well, just do the right thing. Do whatever you're doing. You got to do the right thing. All the other good stuff follows if you're doing the right thing.
And the right thing, guys, is do unto others as that you would want them to do unto you. It's very simple. So we're going to have some funny questions. If you could pick one thing, because you're an avid outdoorsman, mountain biking, motocross, or hockey, what would it be and why?
What age?
Right now.
Well, tomorrow I'm going motocrossing. I love it. I know it sounds great. I grew up racing motocross, and then I got into mountain biking, race mountain bike. So, but the funny thing, I said what age, because 100%, doubling down when I was younger, it was all motocross. anything risk taking, I loved, But funny thing is, I'm getting in more into, hey, I am 55, so I'm slowing down a little bit, not a lot, a little bit. And so golf, I'm getting into more of that stuff. So I enjoy it all.
Pickleball? You play pickleball yet?
I've only done it once. I played squash and actually won a state title in squash, but that was years ago. That kind of, believe it or not, squash beats you up, that racket sport. I mean, it's a lot of lunging, diving, all that. I was like in my 30s, early 40s. I'd go to work limping. Like people, you have no idea how tough that sport is because the rallies go forever. But I've only played pickleball once. I liked it. It was on a vacation. I liked it, but I guess you can only do so much, So I pick my times. I mean, between in the winter I tend to skate a little, play hockey, and because the weather here is bad. Maybe this year I'll do a little pickleball. We'll see.
I love that winners beget. There's a different way. I always call it. There's a different method to the quarterback, and for me, I employ 25 or 30 people like you do. I have a daughter. Everybody relies on me. I don't do anything that puts me at risk.
Well,
at all. Which
you talk to my wife?
No, I love that.
Yeah. Well, I keep my wheels on the ground now. I'm not jumping. Okay. So it's trail riding. I got my buddies I ride with. We rode our whole lives. I have actually guys down all over the country that we get together with and still do some riding. Not a lot. I mean, if I ride 5-6 days a summer here, but I love it because it's outdoor. It's exciting. People don't realize this. This is because I take care of some pro motocross guys, and Roger DeCoster, which is like the team leader of KTM and great guy. He's 83, guy still, by the way, on his 83rd birthday this year. I think I'm getting his birthday right. He lives in California right now, but his wife texts me. He's like, he went out and rode 80 miles on his bike. And now he's a biker, road biker, but I mean, anyway, so, but my point here is, with, it's you got to do what you love. I do modify things like what you're bringing up conservatively, because I don't want to put myself at too much risk. So I'm careful. And part of being careful, and it is, I mean, doing this, intentionally. I can't ride 3 weeks a year, too much risk, but a few days.
Well, your muscles. Yeah, listen, I'm a couple years younger than you, and my muscles start hurting. Anything I do, anything I do, I got to be careful. So another question is, what's your favorite guilty pleasure snack that doesn't quite fit in the longevity category?
God, you did talk to my wife. Let's see here. It's always late at night. It's usually after I've done way too much cardio and had too much stress of the day. Because I do mix up between the weights and cardio and all that. Sometimes when I overdo the cardio, I'm like still hungry at night. You know what I mean?
Yeah.
It's just chocolate, like chocolate or cookies, chocolate chip cookies or that kind of stuff at night. Yeah.
I'm a chocoholic for sure.
Yeah.
We didn't even get into your daily routines because it's going to sound just a lot like mine, and I guarantee you we're gonna have to run this back, but we're getting up against it. So, but between you, your wife Victoria, your 4 kids, and your 2 dogs, who has the quirkiest habit, and what is it?
Oh wow, quirkiest habit, and what is it? This is my wife's going to kill me. It's my wife Victoria, because she digs this. This is like she likes this. What I'm about to tell you is like. And yes, I'm blessed because of this, but it is weird. I'm like, I don't get this. She loves to vacuum. And she's very athletic. She works out. It's not like she doesn't she has she's like, she'll vacuum twice a day. And she's like, it's therapeutic to me. I just love it. Don't quit picking on me. And I'm like, babe, I appreciate it, but I do find it interesting. She loves it. So by the way, when I'm in a bad spot, and I'm on the, the list, what do?
Start vacuuming?
100%.
So he's smart, people. He's smart.
I pull out the vacuum.
That's hilarious. Is there anything about you that people might be surprised to know? Well, here, I will say this, because I have a lot of energy. And I'm very sports active. I've been that, wild child as a kid, long hair. No one thought I could go to medical school. I always like people that, discount me. And, like I was told I couldn't make it through medical school by many people. People don't believe, maybe because I'm a doctor, they believe this, but I read a lot. I read a lot. I get up every morning. I read biblical stuff in the morning, and I read science stuff after that, before I work out or anything. Did it this morning. And my wife's a big reader, and she's actually a writer. She's working on a memoir right now. I'm actually working on a book. It'll be out in about four months. But that shocks people. They're like, what's the name of the book?
By the way, they're like, there's no way he sits still that much to read a book. That's what my kids say. And I'm like, well, you just have to get up at 5, 6 o'clock with me and you'll see me reading.
You talk about vacuuming with your wife. When I read, I relax. It puts me to sleep, even though I get through it. I read a chapter a day and I make sure I get it. Yeah. That's it's under the radar winning habit.
Yeah.
Read, expand your mind.
Yeah.
Even if it's just listening to an audiobook. Yeah. What's the name of your book? Can you say it?
Well, we're working on a few different names. But I can tell you what it's generally
What's it about? Because we'll have you back on, because one of the things that we do, all these books are people that have been on the podcast. So I read their books and then we have them back out. So we'll have you back on when it comes out.
Love it. Yeah. About 4 or 5 months. So it potentially might be the Deep Six. It potentially might be. The other one is the race you don't want to win. 10 seconds, because every 10 seconds in America someone dies. And we're working on a few others, but the title isn't. I don't. Well, you read a book. Of course. It sometimes comes later, organically.
That was the last thing I came with, and then we've taken it to the next level. So some of these books too, and we got to get out of here so we're up against it. But some of these books, you need to read them. They're like showers. We shower every day because they work. Even though if you were to do the Deep Six and repeat it, it's worth it. It needs to be out there. It needs to be repeated, because people think that, of course, my gut, my hormones, my genetics, my liver, my mind and my body, my structure need to be intact. Of course that, but what are you doing about it? And when you're holding the book in your hand, you're going to do something about it. So, Jim.
And I love that. And that's very true. What you just said, that's so true, because I see it day to day. You know what I mean? Because people will, let me tell you, I got 2 people on my mind right now. One, I text this morning at 6 a.m., one of my patients. Even my patients with my direction are getting into the weeds. You know what I mean? Like the rabbit hole of whatever they think's going on. I know what's going on.
Google's not your friend, people.
So I'm like, so what am I doing? I'm on where I'm like, listen, we got a little off track. Just trust me, which he does. He's seen me for years, but it's like, we're going to get you an answer. And my point though is, with that is you gotta focus on, those 6 points are really key, or see somebody that's willing to at least explore those if it's not us. So we have Longevity Health Institute.
We have a new book coming out. It's going to be called Happier Than Life, and it's called the Siegel operating system.
I like that.
Siegel operating system. Yeah. It's going to be my 6 points. That is more of it's all these, but from a do perspective, meaning action, like the mind and body and the hormones, the gut, and the structural big. That's the foundation of being harder than life. So anybody that is having trouble with their 6 inches between their ears, send them my way, and we'll get them
Yeah.
We'll get him.
Yeah.
And we're going to.
And I should do the shout out to something just because I want to say this is that the 6-point model, the Deep Six, listen, it ain't rocket science. Okay. One of my mentors, Dr. Sejun, she runs Sejun Medical Clinic, Dr. Patty. And long story short, she was a mentor to me and started me in my health like 15. Now, it wasn't just like this, but it was just like, and this was like 20 years ago. And she's been doing, practicing whatever holistic functional, medicine for a long time. And the point was, even she's an Indian lady, a little older. I think now she lives on some island. Long story short it was just about don't accept just one answer. You know what I mean?
Yep.
There may be 2 or 3, meaning hormones, your gut, stress, are you sleeping, all that stuff. You know what I mean? Where people like, oh, I got low testosterone. Boom, focus on testosterone. By the way, it's important, but that's all they are. You are not just low testosterone.
Yeah, we didn't get into that. Yeah. But that's what before I found you, I hated. I'd ask somebody the same question and say, are you going to prescribe me the same thing no matter what my blood test says? And like, what do you mean? I'm like, the last 10 people, did they get the same freaking diagnosis? Did you give them the same cocktail?
Oh, yeah.
And if the answer is yes, I'm not coming to you.
Yeah, yeah.
And it just happened to a holistic doctor, to my girlfriend in Utah. Mm-hmm. And I said, this is what they're going to tell you to do. And she comes back, she's like, that's exactly what it is.
Yeah.
I knew it.
Yeah, there's somebody out there, I don't want to say names, but in Michigan that does all this parasite stuff. Okay, literally, like they're a GI, quote unquote, holistic, okay, and parasite. So my patients, I don't have many, but some other practitioners told me that they have a few patients that have come. So they're seeing us, which I don't know why they do this, but they see her Instagram or whatever, and they go deep dive into parasites. Sorry, I have to take a second.
Oh, good.
It's like a surgeon. What do you think they're going to find?
Yeah.
They're going to find parasites, and they're going to tell you have parasites, and you need to be parasite tested, or treated. It's like, oh my God, how can everybody that sees you has parasites?
You said it. It is so simple. Everything in life is simple. We make it difficult.
Yeah.
Jim, thanks for playing on the Heart of the Life podcast. Man, we could talk for hours. We're going to have you back again, and we're going to have one of those other 5 different jaunts that we talked about. Thanks for being on the show. Appreciate you very, very much.
Pleasure.
Please rate and share this podcast. I'm active on all social platforms and love to hear from my Siegel supporters. Each and every episode is sponsored by my company, National Technology Management, the easiest and best IT company to do business with, delivering peace of mind with technology every day, even simplifying cybersecurity. Visit trustntm.com for more info. Until next week, be harder than life.